We see a fair number of our patients that come into our practice with the chief complaint of snoring. Snoring is, for a lot of patients, some of the initial clinical presentations for other sleep disordered breathing, like obstructive sleep apnea or upper airway resistance syndrome or a number of other conditions. What's important to remember, though, is that the literature has demonstrated there is a continuum between snoring and obstructive sleep apnea. So if one snores and snores excessively and it goes untreated, we have the potential to have an obstructive sleep apnea condition arise. So it's important that we treat snoring as a definitive entity. A lot of times with our appliances, we're able to treat the snoring for our patients, but not eliminate all the snoring. The snoring, or a totally silent patient, sometimes is difficult to achieve. However, if we reduce the snoring significantly, we can achieve clinical success. Snoring is a entry level for a lot of patients into the practice. A lot of people will come into the practice with a complaint of snoring, not realizing that they have other sleep disordered breathing. From a reimbursement standpoint with insurance and things like this, a lot of times snoring appliances are not reimbursed. However, if a patient does have a sleep disordered breathing, those things are reimbursed. So it's important to have a laboratory study done with the proper diagnosis so that we can secure and attain the proper reimbursement for our patients.